Yes. Yeah. So what was our research problem here?
It was, what is it? The finding the intracranial pressure in children.
Yes. I want to know, my question over here is, I want to know what are the proxies for intracranial pressure in kids? Okay, when I say proxy, it is basically like, hey, if you have this finding, that means that there is intracranial pressure increase. Okay, then come back to our two conditions that I spoke about. First thing is acute, and the second thing is chronic, right? In acute, now, does it make sense to explore imaging in chronic cases? Not a lot of sense, right? Not a lot, because you have better clinical methods which you can assess easily.
Yeah.
Now, so what will be my then in acute cases, it makes a lot of sense because your eye doesn't have enough time to develop those changes.
Mhm.
Okay, so now our problem is essentially saying that, hey, I have a method which I can do. That is a new method. That is, I want to use ultrasound guided probe to assess the central retinal vein pressure, right? That is what I can do. That is, this is called feasibility of what you can do. Right now, in that, what is the real problem that I want to address? That is, in acute cases, what are the causes of acute increase in intracranial pressure? This is my question number one. Causes of in acute increase in intracranial pressure.
Okay.
Okay. Second thing, I need to look at, okay, what are the range for normal pressure in adults? If it is there. If it is not there, you look at, okay, proxy of what has been given for other cases, like it could be animals, it could be blah, 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 whatever, right? Then once that is done, what is my third thing? I need to select the right population, right? I told you that we have some sort of database for adults, and adults, right? They're not really changing a lot. After 18 years, you don't really change much. But in kids, from when I say kids, right, less than 18 years, from birth to 1 year, it is different. From 1 year to 2 years, it's different. There's so much rate of change that you need to be wary of, that you need to really think about what age group will make the most sense. Okay, how I like to suggest is you need to take age groups based on 0 to 5, 5 to 10, 10 to 15, and 15 to 18. Okay. Now, if in this classification that we have come up with, which group would be very similar, most similar to adults?
15 to 18.
15 to 18. Okay. So leave them. Okay. Now you have to focus on the three groups. Right. Now come back to what is the goal that we need to look at? Acute increase in intracranial pressure. Right. One of the causes could be rapidly progressing tumors.
Mhm.
Or there are some tumors which are causing only small increase in ICP, and we need to look at prognosis of those tumors. Okay, if there is a small increase in ICP, that will not reflect in papilledema. So what have we done? We have expanded the case where we can also include a chronic case. Right, that is our literature review. Where else can we use it? Where else it will be useful? Right. So what was that? We've told that small increase in ICP where there is no papilledema. I need to, so what is the second question I'm thinking of? I'm thinking of what is the time that it takes to develop papilledema, right? How long should there be increase in ICP to take papilledema? Then how much of increase in ICP does it require to develop papilledema? Is it 2 mmHg higher than the normal 3 mm? So that is the second question. How much increase? Correct. Now, what have we done? We have tried to visualize what is possible, right? And with what technology we have, and we have tried to narrow down on who our target population should be. Do you agree? Till now, are you convinced that what we are doing is the right approach?
I think so, yeah.
Right? Now, if you have limited resources, right? Which target population would you choose in the three groups that we have made, and why?
Mm, I think I would choose 5 to 10.
Okay. Why?
Um, because it's like in the middle, you have 10, which is closer to like those preteens, and you have
Mhm.
5, which is like closer to that toddler age. So I think it's like
Mhm.
that perfect age group where you can kind of get ranges similar to younger and older kids.
Okay, that makes sense. But I would like to push back. You know why I would like to push back? I would like you to say that, what was our goal? Our goal was to look at the causes of intracranial pressure. Right. I would say that rather than going blindly with an age group, right? Choosing this age group based on logically what you're saying makes sense. But what you should be doing or what you should be thinking about is which age group is most susceptible to the conditions that are causing these increase in ICP.
Okay.
Right? Is it 5 to 10? It could be 5 to 10. It could be 10 to 15, right? And we had a narrowed down definition, right? What all conditions we can look at. So we need to look at, okay, which age group are being affected by those conditions that we pre-selected. Make sense?
Hmm.
That is much more refined research, right? And it will be, you're not wasting your time also, and it's being most relevant. Right. So I would say, for example, see, I have not gone through and read the papers, but I would say it would make more sense if it is 10 to 15. It's an assumption. I can be wrong. You can go, like I said, right? I need to be challenged. For that, only when you read, you can challenge. Right? So that's the assumption that we have taken. And now what happens? See, this is all good, right? When we are discussing framing protocols, ground reality is what if I'm not getting cases from 10 to 15? I have to meet like my sample size of 100 or 200 patients. If I'm not able to meet, what will happen? I won't be able to complete the study. So I will take it from 0 to 15 years. Okay,
Okay.
then I will divide it into cohorts. Okay, then from there I'll try to draw insights. There's nothing wrong in that, right? But if you want to be precise, I would say you need to think about very intentional about what you want to prove, right? And I would say exclude the 0 to 5 because there is a lot of variability with respect to how growth is occurring, right? As much as we can standardize, we need to standardize.
Mhm.
Make sense? So this is how we are thinking about what population that we need to study. See, I have not even gone to any paper till now. Right now, all I'm doing is someone told me that, hey, this is the problem. I thought about, okay, how do I address this problem? What are the things that I should be looking at? Then what are common sense questions that I should be asking myself? So you made a list of questions, right?
Yeah.
Now, once you have this list of questions, then you should go to Google. Have you heard of PubMed?
Have I heard of what?
PubMed.
No.
Okay, so how we have Google, right? So PubMed is like index. It's like Google, but for medical research. If
Okay.
you want to see, like there are multiple journals. So I do research, I publish in a journal. That journal puts it on the internet, on their website, right? PubMed will take it'll show that my article has been published in XYZ journal. So Google does not rank all the websites, correct?
Hmm.
Google ranks only, most of the websites, but not all the websites. PubMed is also very selective about what kind of journals that they can rank. So if it is on PubMed, then I would say that the journal is good.
Okay.
Okay. Central retinal vein pressure. That was my general thing. So it'll tell, okay, what are different things so this is PubMed, right? What did I tell you PubMed was? PubMed is a way that you're indexing something.
Mhm.
Now, in this, I would also go into what are types of research that are out there. One is what we are trying to do is called original research, where we have taken an idea, we are trying to develop a methodology and systematically evaluate the possibility in this condition. Next, the other thing is, so before we do that, what is required? We should know some idea about what we are talking about. Right. So there are experts in the field, like your professor may writes a summary of where the field is right now. Those are called reviews. A review article, if it is systematically done through using protocols and through using guidelines, then it's called a systematic review. Right. And the RCT are randomized control studies, which are the gold standard of evidence. That is a type of, original research, which is one of the best, right? So till now, what do we have? We have review papers. Review papers can be, see, there is no systematic approach. In review papers, I say that, hey, these are the 50 papers that I've studied. Based on that, this is my interpretation of those 50 papers.
Okay.
Make sense? Now, systematic review is there should be a reason why you studied those 50 papers. I should give that rationale. So if you try to do it again at that day, you should approach the same 50 papers. Then only it is systematic review. That's the difference. Right. Now, if we don't know much about the topic, right, rather than you going and searching everywhere else, what should you do? Someone has already put that effort for you, right? You go to PubMed, you type the central retinal vein pressure, the as general as you can be, come to the filters side, then you select the systematic review. Right. Then you see that, okay, what is the topics that we can see? Efficacy and effectiveness of steroid versus combination therapy for macular edema secondary to retinal artery vein occlusion. Okay, okay. Compassion, blah blah blah, efficacy. Yeah. So basically, they've done different methods where you can look at, different things. But yeah, so I had already done this. So what I did here was, I like to keep the most important reference paper, right? That's the first thing, which where I should have, if I read this paper, I should have a basic idea of what they're talking about. See, retinal vein changes as a biomarker to guide diagnosis and management of elevated intracranial pressure. Do you agree that this is what we are planning on doing?
Yeah.
Right? So what this review paper will do is it will introduce you to what this intracranial pressure is, what are the causes of increase in intracranial pressure, what are the methods where, see, like I said, what is papilledema, and they'll tell you it's the swelling of optic nerve due to XYZ conditions. Right? If you read this review paper, you will get an insight into what intracranial pressure is and what to do, right? Why I like review papers is they'll also tell you what is the lack in the literature, meaning what are the current gaps that you can address, right? So if this was my review paper, I can copy this, right? I can copy this. I can go to either PubMed, or let's say I go to Google, I paste this. I'll see so if I open this on PubMed, right? When I come down, I can look at papers which are similar to this.
Okay.
So this will get me other set of papers that are giving me an idea of, what could be there. See, here they have done in pigs. See, with pigs, right, you can actually do an invasive technique and you can record the exact intracranial pressure. But you can't do that in humans, no? That's why we don't have that data. So yeah, that's some limitations on each methods, but yeah, that's fine. So the goal was you go to if you find a good article, you can either go to Google or PubMed. If it's a research article, ideally PubMed. once you see, if you kind of know the exact domain of what you're looking at, or if you want to get ideas, go to PubMed, right?
Okay.
And give a general topic and see what was our search term in PubMed. It was central retinal vein pressure, right? Now they have given me ideas about what it could be, right? They're telling that, hey, if I'm giving some steroids, what is happening to my retinal vein occlusion, right? Is it getting better? Is it getting worse? Right? And that's the thing. And I can look at, okay, etiology is the causes, meaning that, okay, correlation between. When I say cause, right, I need to look at what are the reasons why intracranial pressure can increase, correct? So that's how I'm looking at my topic. See, and they're like, okay, see, this is another thing, a novel method for evaluating retinal vascular morphology and its diagnostic potential in eye-related diseases. Do you agree? Now, my metric was, okay, what should I tell the radiologist, right? Arteriovenous length. I should be like, hey, can you please measure this length in these patients and give it to me? Right. So when you click on this, they'll tell you like, okay, what are the data sets that they've used? What is, what exactly that they have done? And then how do I assess this? Like, see, even when I look at it, I'll just be like, okay, I know something. Only if I read it, then only I'll get an idea of what they're talking about. Or else even I won't know because this was somewhere few years ago I read. So that's kind of how it's going to be. So this can be something that we can use to give guidelines to the radiologist. Okay.
Okay.
So what I had prepared here was an idea of, okay, what are the interesting papers? These are must reads, right? If you go through these, you will get an idea of what we are trying to talk about. And how to go through these is go to PubMed or Google and you need to develop your idea. See, without having questions prior, if you go and search, right, you will be nowhere. So what we tried to discuss today was, how did we select an idea? Once we selected an idea, what did we do to systematically, just by our common sense, figure out the questions that we need to ask? Then try to look at how to search PubMed and how to search Google to look at what is the proxy that will give me the most knowledge in the least amount of time. What was that? They were called systematic reviews,
Yeah.
right? If I read systematic review, I will get a quick idea of what this topic is. Once I'm done with the systematic review, see in the systematic review, right? They would have put small things like with respect to. Let me show you. Yeah. So if you read this, yeah. So this is free. You open it and you will be able to, they would have put references, right? Somewhere in between. Yeah, this references over here. See, they're like, okay, see, through digital methods of measuring force, right? Whatever. So that is one reference. And detection of spontaneous retinal venous pulsation is often used as a screening tool. And they've explained like why it should be used, why it can't be used. See, specificity of 20% to detect only high ICP. So we can be like, see, you can detect only high ICP, but what about middle ICP? So that is something. So you click on the reference over here, you go to this paper, copy, and you paste it in Google. You should be able to open it and you will get this abstract. So what is this? This is an abstract. When you read an abstract, you go to the methods. When they say prospective, essentially what they're meaning to say is, hey, I did the study looking forward, right? Meaning that I developed a SOP, then I enrolled patients and I controlled what I could collect. That's prospective. When they say retrospective or chart review, it means that they've already collected data. You can't collect new data. So based on that, this is what I found. Make sense? So if you read this, you have to read through method first, and you'll get an idea of how they have written their method, right? And based off that, you can look at what is the rationale that we have to use and go from there. Right. So I would say for today, we'll end till here. And your assignment would be I will send you the link to this document that I've created. I've tried to give like a small introduction with respect to what we are looking at. I'll tell you, see, you just read through the introduction. And once you read through the introduction, you just highlight the words or things that you have not understood.
Mhm.
Highlight it. Once you're done that, and this is like an objective. See, one is introduction, second should be objective. What was the objective of our study? To provide a non-invasive marker to evaluate ICP. And what is our marker? Ultrasound method, right? Then methodology, study design and all, we will discuss later, right? And we'll focus on what is our understanding. So first we need to understand the topic. And then I have tried to summarize what I've understood. In the animal work, right? They have said that papilledema did not develop, right? So in human work, there are reasons for papilledema not developing. Then what are they doing currently? What are the options? Papilledema is the only reliable thing. I can look at other factors, right? So what are the other factors? That's the thing that I saw. Then in when it comes to imaging, what are the things that matter, right? What is the actual intracranial pressure, right? How much is the disc? Like how is it getting bigger? And how much mean pressure should I call it as ICP increase? Right, so these are the technical documents. And like I said, see, this is my eyeball and this is my brain structure. And in between, there is this connection. Here I have cerebrospinal fluid. Okay. So, and they've given models on, and these were certain models on why, if there's increase in pressure, there is a collapse in the vein. See, for you, it will be a little bit harder to understand these concepts because I myself did not understand them. That's why I told my friend to read through it. I lost patience. They're talking about so many things. I'm like, okay, this is a little hard, but I would not recommend you going into nitty-gritties about, hey, why is this increasing? How is this increasing? Blah, blah, blah. Right? Our goal is, ask the right questions. Don't get deviated with respect to finding all answers. It need not matter if you have all the answers or not. What were the few answers that we needed? What is the normal central retinal vein pressure for humans? And is there a difference between adults and kids? Now that question is easy, not to find. I don't have to read through everything. So I know exactly what I want. Then the second thing would be, in that I need to justify the rationale for my study. Right. In this review only, I should look at, okay, is my study even required? If I publish this study, right, am I going to change the clinical practice that is prevailing? That's the question that you should ask. Then the implication would be, imagine every pediatrician carrying a small ultrasound device, which can just easily record it and say, we would have pre-filled these values based on the age of the patient, where they'll be like, it will say red, blue, or green. That is a end implication. Right. Why do you need very big fancy devices? Anyway, it is just sound. No, see, technology is technology. How you package this is up to you. So that is the end implication of this paper.
Okay.
So we need to, that will be our future directions, like how we need to see. We are the experts. No. Now, if you also read, you will become an expert compared to other medical graduates because they won't know all these things. Right. Once you have been able to understand what you're trying to say, then you can give directions on what to do next. Make sense?
Yeah.
Yeah. So this is we should focus on in the initial stage, we should see that should we even do the study in the first place? Now, are you convinced that this is a good study to do?
Yeah.
Okay, so tell me why. Why do you feel I'll stop it? So this is done with our teaching. So we'll spend like 5 to 10 minutes and going through like what you understood. If you have any doubts, I can, help you out.